Indications for a myocardial biopsy. You could say myocardial biopsy, you could say what? Endomyocardial biopsy. Either way, you are trying to like what? Put a biopsy catheter to take some tissues from the heart to send to the lab for testing. Alright? So indications for this type of biopsy is basically like what conditions will necessitate what? You doing this biopsy. Alright? So indications for heart or endomyocardial biopsy or myocardial biopsy, anyone. So if the patient has an acute dilated cardiomyopathy with refractory what? Heart failure symptoms, you might want to do a biopsy, okay? Then if they have a rapidly progressive ventricular dysfunction in an unexplained cardiomyopathy of recent onset. So you have a problem that is really unexplained. So you want to go in and actually what? Send these tissues to the lab to be very sure of what is causing it. Alright. Okay. Then if there's a new onset of any cardiomyopathy with recurrent what? Ventricular tachycardia or a high grade heart block, you might want to do a biopsy. Then if there's heart failure in the setting of fever, rashes, or any peripheral what? Eosinophilia. Alright. What could actually what resolve this could be a biopsy. You basically know the exact thing that is wrong. Then if there's a dilated cardiomyopathy in a setting of what? Systemic disease conditions known to affect myocardium, like what? Systemic lupus erythematosus, polymyositis, and sarcoidosis. So if there's a dilated cardiomyopathy amongst these disease conditions that you know that they affect the muscles of the heart, you might want to confirm by doing a biopsy, right? So this is how a biopsy is done. You put the catheter, all right, and the catheter will help you remove what? A muscle sample, which you send to the lab so that what? A test result can come through. So these are the possible indications for myocardial or endomyocardial biopsy.